पे आया है क्या? फिर स्टार्ट स्ट्रीमिंग नहीं करते। स्क्रीन अच्छा, एक मिनट, ये देखो ये आ रहा है क्या? क्योंकि 2-3 बार से ये एक कोने में चले जा रहा स्लाइड्स। देखो क्लियर आ रहा है सेंटर में, देखो। एक सेकंड, ओके राइट, ठीक, थैंक यू। Good morning all of you. Today we shall discuss about the ECG, it is the electrocardiograph. In the today's class I will just give you briefly about what is the ECG, what is the basics of ECG, what are the methods of recordings. In the next class on Wednesday we shall see about the normal ECG pattern, the waves of the ECG, and what is the abnormal ECG. We shall discuss about the various changes in ECG which happens in different disease conditions. So now for the beginning, how do you define an ECG? Now ECG is defined as the recording of the combined action potentials of the heart. It is a record of the combined action potentials from all the myocardial fibers during each single beat. Now we know that the electrical activity is going on in the heart. This electrical activity is transmitted from the heart to the body fluids, and through the body fluids these electrical impulses reach the surface of the body. Now when these electrical waves reach the surface of the body, you place an electrode on the surface of the skin. The electrode will catch these waves and will record on a machine. So that is electrocardiograph, and the machine is electrocardiograph, and the recording is known as an electrocardiogram. So basically we know that there are hundreds of myocardial fibers, and each of these myocardial fibers are generating an electrical impulse. During each beat, all the impulses, all the electrical activity is integrated and is transmitted from the heart into the surrounding body fluids. From the surrounding body fluids, it is transmitted to the surface of the skin because the body fluid is a good conductor of electricity. And why is the body a good conductor of electricity? Because of the presence of electrolytes in the body fluids. So since you know that there are sodium, potassium, calcium and other chloride ions present, these electrolytes are a good conductor of electricity. So whenever an electrical impulse is generated in the myocardial fibers, it is transmitted to the surface of the skin. And here if you see, if you put an electrode on the surface of the skin, you can have a record of these electrical activity. So this recording of this electrical activity of the heart, which is being generated from myocardial fibers, is known as an electrocardiogram. Now the next question is, once if we are recording an electrocardiogram or an ECG, also called as an EKG, what information do you get from the ECG or the EKG? It is nothing but there are certain waves which are present. These waves are in a synchronized manner. They are repeated with each heartbeat. Mind you, the record of this is in each heartbeat. So when you are recording it, there is a particular segment, and that particular segment corresponds to one heartbeat. So when you take this record for a long period of time, you will get a electrical activity for a long period, So if you put the electrical activity on there for 1 minute, so the record of heart rate is somewhere around 80 beats per minute. So 80 such recordings will come. So here the next question is, once the records are there on a paper and you try to analyze, what information can you get from an ECG? First, the ECG, when you look at an ECG, you should be able to understand whether it is a normal ECG or a normal EKG or an abnormal EKG. The next important information which you get from an electrocardiogram is the heart rate. Whether the heart rate is normal heart rate, or whether it is more than normal, or whether it is less than normal. That means you can get an idea of the heart rate, whether it is a tachycardia or whether it is a bradycardia. Also, you can get information whether the heart rate which is originating, the heartbeat which is originating, is coming from which part of the conducting system. Whether it is coming from the SA node, it is known as a sinus rhythm. You can also know if it is coming from the AV node, it is known as a nodal rhythm, or whether it is a ventricular rhythm. So apart from the heart rate, increase or decrease or a normal heart rate, you can also know whether the rhythm, where is the rhythm coming from? The sinus rhythm, nodal rhythm, or the Purkinje, coming from the Purkinje fibers or the ventricular fibers, which is known as the ventricular rhythm. Next, apart from this, you also can know whether the heart is having any conduction defects. Conduction defects, in a sense, we know that the impulse has to come or is generated in the SA node, transmitted through the internodal tracts and the atria to the AV node, from the AV node to the AV bundle, then the left bundle branch, right bundle branch, then it goes to the Purkinje fibers, and then it goes into the ventricular muscle mass. So we can also know that whether there is a defect in the conducting system. What defect in the conducting system? The rhythm will be known, whether it's a sinus rhythm or any other rhythm. Plus defects in the sense whether the heartbeat, whether the electrical impulses are transmitted very fast or they are transmitted at a slower rate. So the duration of the conduction can be known, and we can also know whether the conduction's velocity is normal or not. In other words, we can know the conduction defects. Thirdly, we also can know whether there is any damage to the myocardial fibers. Say for example, if there is any ischemia or infarction, in common language you say whether there is a heart attack or not, or angina or something, chest pain, there will be certain changes seen in the heart. So those changes can also be detected from the ECG, and we can know whether there is any myocardial damage or not, and if there is a damage, to which chamber of the heart it is damaged, and the extent of the damage. Secondly, another thing, the fourth point is, we can also know whether the chambers of the heart are normal in size or they have increased in size. So we can know if there is an increase in the size of the heart, we can know that there is an increased size of the heart, that is a cardiomegaly is there or not. We can also know if one particular chamber is enlarged or not, like left ventricular enlargement or a right ventricular enlargement or a right atrial enlargement can be known from the ECG. So the size of the chambers can be known from the ECG. In addition to this, the ECG also gives an information about the direction of the flow of the current. With this direction of the flow of the current, it is easy to understand whether it's a right ventricular hypertrophy or a left ventricular hypertrophy, or if there is any specific enlargement of one particular chamber. Then, lastly, you can also know the effect of the electrolyte disturbances in the heart. We know that the sodium potassium levels are important for the normal conduction of the rhythm in the body. If there is any change in the sodium, calcium or the potassium levels in the body, then these effects will be seen in the heart beating will be affected, the conduction rate will be affected, and these changes can be seen in the ECG. So a decrease in the sodium level, that is hyponatremia, an increase in the potassium levels, hypokalemia or a hyperkalemia, or a changes in the calcium levels can also be known by recording a electrocardiogram. So these are some of the information where you can get it from an electrocardiogram. To sum these effects, what is the idea you will get from ECG? First, whether it is a normal or an abnormal. Second, you will get an idea of the heart rate, whether the heart rate is normal or if there is a tachycardia or a bradycardia. Third, you will also know whether the conducting system of the heart is normal or not, whether the velocity of conduction of the impulses is normal or not, or if it is slowed down, there is a delay, and if there is a delay, at what level is the delay. Then you can also get information about the rhythm of the heart, whether it's a normal sinus rhythm, whether it's a nodal rhythm, or whether it's a ventricular rhythm. You will also get an idea of the chambers of the heart, whether the size of the chambers of the heart, whether there is an increase in the size of the chamber, left atrial enlargement, left ventricular enlargement, or right ventricular enlargement, or if the right hypertrophy of the heart is there. That means whether the muscle mass is increased, whether the left hypertrophy is there or the right ventricular hypertrophy is there. Just to add a point here, difference between an enlargement of a chamber and a hypertrophy. Left ventricular enlargement means the size of the cavity is increased. Hypertrophy means also it is increased. But the difference here is, in a hypertrophy, whenever we use the word hypertrophy means that there is an increase in the muscle mass. Whereas in a enlargement of the chamber, the size of the cavity is increased, the muscle mass remains the same. So there can be a left ventricular hypertrophy where the left ventricular muscle mass is increased, whereas there can be left ventricular enlargement of the chamber where the size of the chamber is increased, the cavity within the ventricle is increased, but the muscle mass remains the same. So these enlargements can also be known. You can also study whether there is any myocardial damage is there, to which side of the heart, which chamber of the heart is damaged, and to what extent is the damage is there. Extent is a little lesser known, but mostly it is the chamber of the heart which is getting myocardial infarction or ischemia, that can be determined. Then lastly, you can also know whether the effect of the electrolytes on the heart. So that means hypokalemia, hyperkalemia, or hyponatremia, or a hypocalcemia can also be detected by the ECG. So these are the basic information which you can get it when you look at a simple record, that is the ECG. Now, what are the leads which are present? How do you record the leads? And how do you record the ECG, and what are the different types of leads which are present? Now, in toto, literally there are about 5 different methods by which the ECG can be recorded, and there are this 5 different types is based on the type of leads. So we have got unipolar limb lead ECG, unipolar lead recordings, we have bipolar lead recordings, then you have got the chest lead recording, the esophageal records, and the endocardial lead records. What does this mean? First, let us see what do you mean by a unipolar limb lead record. Unipolar limb lead record means where there is only a single recording electrode, where a single electrode is placed on the surface of the skin. When the single electrode is placed and it records the disturbances or it records the electrical activity, that is known as a unipolar record limb lead record. Then we have got in this unipolar limb lead record, we have got a augmented limb lead record. What do you mean by augmented limb lead record? The word augmented means that the voltage is augmented. Normally, when you put a unipolar limb lead, the voltage is so low that the recordings are very small in size, which becomes difficult to interpret. So through a mechanical adjustment, through adjustment in the recording device, in the electrocardiograph, you increase the voltage by 50%. So it becomes augmented. If the height of the wave normally would be around 0.5 millivolts, because of this unipolar limb lead augmentation, you are increasing the height of the wave by 50%. So that becomes an augmented unipolar record. So this unipolar record, remember one thing, is recorded by a single electrode. The voltage is increased by 50%, so it is augmented. So the recordings are 50% augmentation. Now where do you place these electrodes? These electrodes are placed in the arm and the foot. So it is AVL, the record becomes AVL, AVF and AVR. So it is the left arm AVR, left arm AVL, right arm it is record is known as AVR record, and AVF is for the foot. So that is only a single lead. The record in the ECG will be marked as AVR, AVL and AVF. A means augmented, B is vector and L is the site where you are placed. What do you mean by vector? Vector is defined as the direction of the flow of the current. So that is a vector. So ultimately, what is this ECG recording? This ECG is recording nothing but the combined action potentials, which is in the form of a vector in the direction with which the current is flowing. So it is called as V, and this vector is increased by 50%, so it is called as A. So a augmented vector of upper left arm or right arm or foot. So AVR, AVF, AVL, and this is recorded by a single electrode, so it is known as a unipolar limb lead record. The next thing is that there is a bipolar limb lead record. What does bipolar limb lead record means? Bipolar limb lead record means that the recording is by placing two electrodes. Now where do you place these electrodes? Now basically the electrodes are placed on the limb, hence it is known as limb leads. Since there are two electrodes which are recording simultaneously, it is known as a bipolar limb lead. Now during each of these record, one of the electrode is the active electrode and the other electrode is the inactive electrode. Now let us see what are these bipolar limb leads records named. So when you record an ECG, you will also find that it is named as lead 1, lead 2 and lead 3. Lead 1 here, then this is lead 2 and this is lead 3. So here there are three records in a bipolar limb leads, lead 1, lead 2 and lead 3. Now this is recorded by placing two electrodes. Remember, one is the active electrode, the other is the inactive electrode. Now where are these electrodes placed? What do you mean by lead 1? A lead 1 is the record, or in lead 1, the record of the ECG is such that when the electrodes are placed on the left arm and the right arm. This record, which is obtained when the two electrodes are placed on two upper limbs, that is the left arm and the right arm, that record is known as the lead 1. Then what is lead 2? Lead 2 is the record when the electrodes are placed on the right arm and the left leg. So this becomes lead 2. So lead 2 is the record of a ECG when the electrodes are placed on the right arm and the left leg. Then what is lead 3? Lead 3 is a bipolar record where the two electrodes are placed, one on the left arm and the other on the left leg. So this is lead 3. So basically in a bipolar limb lead record, we have got three records: lead 1, lead 2, lead 3. Lead 1 is right upper arm, left upper arm. Lead 2, yeah. Okay, thank you. Lead 1 is the record which is coming from the right arm and the left arm. Lead 2 is the record which is coming from the right arm and the left leg, and lead 3 is the record which is obtained when the 2 electrodes are placed on the left arm and the left leg. Now among these two there are one positive electrode and one negative electrode. If you see the diagram previously, you will understand where is the positive electrode. So when you place the record on the lead 1, here the positive electrode is on the left arm and the negative electrode is on the right arm. When you record a lead 2, you will find that the positive electrode here is in the lead 2, here it is a positive electrode is in the left arm and the negative electrode is on the right arm. In the lead 3, you will find that the negative electrode is on the left arm and the positive electrode is on the left leg. So these are the recordings which you will see. Here I put it on this diagram. The lead 1 is the negative terminal of the electrocardiogram is connected to the right arm and the positive terminal is connected to left arm. Lead 2 is the record where it is between the right arm and the left arm. The right arm is the negative electrode and the positive terminal is the left leg. And in the lead 3, it is the left arm and the left leg where the negative terminal or the negative electrode is in the arm and the positive terminal is in the leg. So these are the recordings, and this is the thing, more a diagrammatic representation of the polar leads. Here you see this is the AVR, AVL and the AVF. So see here where we have seen the record which is coming here, this is the AVR, this is the AVL and this is the AVL, where you will find that there is only a single electric record. Here the record of the height of the wave is 50% increased. Whereas here you see this is the record of a lead 1. In lead 1 this will be the record where it is the 4 waves are being recorded and these 2 are the recording electrodes. In lead 2 it is the right arm and the left leg, and lead 3 it is this one. See, all this forms a triangle. This is one right angle triangle if you connect it here, and this is another part of the triangle. Now there is another third record which is known as the chest leads. Now what do you mean by chest leads? Now chest leads are those leads where the recording of the ECG is made by putting the electrodes on the chest wall. Hence they are known as chest leads. Now how many types of chest leads are there? Here the chest leads are of 6 types when they are placed on different aspects of the body or the chest wall, where there is only one electrical recording or one recording electrode, that is the inductive electrode. So let us see what are the different types of chest leads. Basically the chest leads are V1, V2, V3, V4, V5 and V6. V means vector. So where is the position of these electrodes when you record it in different chest leads? It is also known as precordial chest leads. Now see this V1. Now V1 is the electrical or the ECG record when the electrode is placed in the 4th intercostal space close to the sternal border on the right side. So that record is the record of the ECG and it is named as V1. So what is V1? V1 is the recording of the ECG when the electrode is placed on the 4th intercostal space on the right side close to the sternal border. Then what is V2? The V2 is the record or is the ECG record when the chest lead is placed on the 4th intercostal space on the left side close to the left sternal border. That is the V2 record. Then what is V3? V3 is something between where the electrode is placed between V2 and V4. Then this is V3. Now what is V4? See the line here, remember this line. What is V4? V4 is the recording of the ECG when the electrode is placed on the chest wall in the 5th intercostal space in the mid-clavicular line. That is the point where the mid-clavicular line is passing across the 5th intercostal space. If you place that lead there, that is the V4 record. So any electrode placed between this V4 and V2 becomes V3. Now what is V5? V5 is nothing but the recording of the ECG when the electrode is placed on the left side of the chest wall in the fifth intercostal space, where the anterior axillary line is cutting the is passing through the fifth intercostal space. That record is known as V5. And what is V6? V6 is the record of the ECG, which is the record of the ECG when the electrode is placed in the left side of the chest wall in the fifth intercostal space, where the mid axillary line is passing through the V5 within the fifth intercostal space. So that is known as V6. So in short, remember this diagram here: V1, V2, V3, V4, V5, V6. V1 is right side intercostal space close to the sternal border. V2 is fourth intercostal space close to the left sternal border. V3 is the electrode which is placed in between V2 and V4. V4 is in the fifth intercostal space, mid axillary line left side. V6 is the fifth intercostal space, electrode placed on the anterior axillary line, and V6 is in the fifth intercostal space, left side in the mid axillary line. So the records which are obtained when the electrodes are placed in these different positions are known as the precordial records or the chest lead records. So now a combined ECG, when you ask a ECG, you will find an ECG will contain the recordings from all different areas, and combined reading of all these different ECG recordings from different leads will help you to determine whether it is a normal or an abnormal, and it will give you the information about what all I had discussed in the previous slide. So lead 1, lead 2, lead 3. You will also have an ECG record of AVR, AVL and AVF. In addition to this, you will also have a record of the chest leads V1, V2, V3, V4, V5, V6. So a ECG recording marks a complete collection, complete display of the information from these different areas, from these different leads. In addition to this, we also have got two other leads, which is known as the esophageal leads and the endocardial leads. The word itself will suggest a esophageal lead is a lead when for the recording purpose, the ECG is placed in the electrode is placed in the esophagus 35 centimeters from the inside the teeth. When you place that electrode at a 35 centimeters into the esophagus from the inside the teeth and record the electrical activity, that is known as esophageal record. But that is not done, just remember it for theoretical purpose. The other is the endocardial leads. The endocardial lead is the lead which is recorded when the ECG is placed in the cardiac chambers itself and you record the electrical activity. Those are the endocardial leads. Now then, once this recording is over, a brief information on the recording device. Now when you see this ECG, here. When you see this ECG record here, you will find that this ECG record has a paper. In this there are big squares and small squares, and there are two axes, the x-axis and the y-axis. Now the x-axis recording will record the time. The y-axis recording will give you the height of the strength of the electrical current. In simple words, x-axis will give you the time duration of the wave. The height of the wave will give you the voltage which is being generated. So remember these two things. X-axis is with respect to the time calculation and y-axis is with regard to the voltage calculations. Now, on the x-axis, each square will correspond to around 0.04 milliseconds. So when the ECG paper is placed and it crosses one small square, that means 0.04 seconds have been elapsed. So that means when it crosses this whole square, the total duration will be 0.04 into 5. So it is 5 squares have been crossed. So it is 0.5 seconds. So when the ECG has moved, or the recording device has moved from this end to this end, the duration between these two lines would be somewhere around 0.5 milliseconds. Similarly, on the upper high, on the y-axis, which is recording the voltage, this height will be somewhere around 0.1 milliseconds, and once this box is crossed vertically, the height is up somewhere around 0.5 millivolts. So between two squares, the duration of time is around 0.2 seconds, whereas the height is somewhere around 0.5 millivolts. Remember this. Now, this is about the calculations on the recording graph paper, ECG graph paper. Now, what is the speed of the device? When you start or turn on the machine, the ECG paper comes out at a constant speed. So, when it is coming out at a constant speed, what is the speed at which the paper is traveling? It is traveling at 25 per second. So, in every second, 25 squares is crossed. So, if you take the ECG and the recording speed of the paper, it will pass somewhere around 1500 small squares per minute, or 300 big squares per minute. So remember this value is important because based on this recording speed calculations only, you can calculate the heart rate which is present there. Now you can calculate the heart rate of the person through an ECG. So on x-axis, between two squares, the time gap is 0.02 seconds. Big square. On y-axis, the voltage somewhere around 0.5 millivolts. The speed of the paper is 25 per second, or it can be said as 1500 small squares per minute, or 300 big squares per minute. So this is the speed of the recording paper. Now let us come on to one thing where if you have noticed something, you will find that there is always a triangular formation taking place. So mostly you will see that the triangles are formed with these recording diagrams. So there is one law which is known as a Einthoven's law and a Einthoven's triangle. So what is an Einthoven's law? What is first of all a Einthoven's triangle? Now if you connect the leads all together, then this triangle is known as a Einthoven's triangle. This is the Einthoven's triangle. What is this Einthoven's triangle? You join the lead 1, you join the lead 2, and you join the lead 3. When all these three leads are joined together, it gives a triangle, and this triangle is known as the Einthoven's triangle. Now what does the Einthoven's law states? The Einthoven's law states that the electrical sum of the electrical potentials of lead 1 and lead 3 is equal to lead 2. That means if you add the sum total of the voltage which is present in lead 1 combined with that of the sum total with the total voltage in lead 3, then the combined voltage will be equal to the lead 2 voltage. That is the Einthoven's law. So Einthoven's triangle is an equilateral triangle formed by connecting the three leads. When you record the voltages of these three leads, you will get the Einthoven's law, and you will find that the voltage which is generated in lead 2 is equal to the sum of the wave voltages in lead 1 and lead 3. So here if you see the diagram, if in lead 1 the voltage is somewhere around 1 millivolts and in lead 3 it is 0.5 millivolts, then the lead 2 total sum voltage will be equal to lead 1 plus lead 3, that is 1.05, and it is 1.5 millivolts. This is about the Einthoven's law and the Einthoven's triangle. This is just I had shown you earlier, V1 to V6 record. Here it is the diagram where you have connected this lead 1, lead 2, lead 3. This is the Einthoven's triangle, and in this the law states that the sum total of the voltage of lead 1 and lead 3 is equal to lead 2. Now here you have to understand the mean electrical axis. What is mean electrical axis? Now the mean electrical axis is defined as the single combined action potential of the heart. Now it is the direction. We know that the whole of the cardiac muscle fibers are generating current, they are generating negative electricity, positive electricity, and sum total of it is a vector. The direction of the flow of the vector is called as the mean electrical axis of the heart, and this mean electrical axis of the heart is nothing but the line or the direction in which the combined action potential is flowing. So the direction of the flow of the current in the whole of the heart is towards the apex of the heart. This red line is showing the mean electrical axis of the heart, and this mean electrical axis of the heart is always parallel to the lead 2. If you see lead 1, this would have been lead 1, this would be lead 3, and this would be lead 2. So the mean electrical axis of the heart is the direction of the flow of the heart, of the current in the heart, and it is towards the apex of the heart, from the base of the heart to the apex of the heart. This mean electrical axis is always in parallel to the lead 2. Now what is the mean electrical axis of the heart? The mean electrical axis of the heart is somewhere around -30 to +110 degrees. Now what does this mean? I'll show you in the next diagram. Here you see. Now just imagine that this is the Einthoven's triangle, and in this Einthoven's triangle we draw a circle here. So now using these edges of the triangle you draw a circle. This circle you divide it into by drawing straight lines, certain segments. It is divided into number of segments. Now imagine this circle in this triangle and place the heart in the center of that triangle. That will give you the mean electrical axis of the heart. So two things I am saying. Here it is the Einthoven's triangle. In this triangle you form a circle. So this circle superimpose on this picture, it will be a circle. Now draw lines, and these are nothing but the vectors, direction where the current is flowing. So this becomes a circle with a Einthoven's triangle. Now imagine the circle, imagine a heart in this. So the center of the circle will be the center of the heart, at which there is no electrical activity taking place. So go back to the first diagram which I had shown you here, and you will see that very carefully here. The next one. This. So now imagine this is the Einthoven's triangle. We have drawn a circle connecting all the three angles, and you place the heart in this center of the triangle. When you have placed the heart in the center of the triangle, the center of the circle there will correspond to a point which is the center of the heart by means for electrical purposes, and that point there will be no electrical generated or no electrical activity going on. Now if you divide and see the distribution of the current there, you will find that here there is zero current, but above the center of the heart, here above the center of the heart, you will find that there is much electrical activity on the negative side, and below that you will find that there is a positive current generated. So the axis of the heart, if it is flowing like this, should be somewhere, the mean electrical axis should be somewhere between -30 and 110. So in between this you will find that the electrical activity of the heart is taking place. Now in an ECG, what is its significance to the ECG? In an ECG, this mean electrical axis can be known by the height of the R waves. If the height of the R, by the height of the R wave, you can know the mean electrical axis. if the mean electrical axis is more than 110. So instead of excuse me, instead of the line passing at this point, if this line passes somewhere above 110, say 110 will be at this point, if it is passing like this, the electrical axis is passing like this means that there is a right ventricular hypertrophy, or there can be a right bundle branch block, or there can be a conduction defect in the anterior fascicle of the left conducting system. So that is the information we can get by the mean electrical axis. Normally, I repeat, the mean electrical axis should be somewhere between -30 and +110. Then that is a normal electrical activity going on. This can be determined by the height of the R wave. If the electrical axis is shifting to more than 110 degrees, it means that there is a right ventricular hypertrophy or a right bundle branch defect, or the anterior fascicle of the left conducting system is having a conduction delay. Similarly, if the electrical activity is more than -30, let's say -40, -60, -110 or something like that, that means that the electrical activity is deviated, mean electrical axis is deviated. That is seen in left ventricular hypertrophy, left bundle branch block, and in the damage to the posterior fascicle of the left conducting system. So imagine this, can see the heart is getting enlarged. There you just imagine the left apex of the heart and the right side of the chamber. The right side of the heart is getting enlarged on this side, so the axis is shifting towards more than 110. If there is a left axis, left ventricular hypertrophy, the axis will shift towards the left side above -30, and that will indicate that there is a left ventricular hypertrophy or a left bundle branch block or a defect in the posterior fascicle of the left conducting system. Now here it is the voltage here which we can see. Here the combined voltage, if you see in lead 1, is average around 0.5 millivolts. Here if you see it is 0.7 millivolts. Einthoven's law states that this is 1.2 millivolts. So these are about the limb leads, the chest leads, and the recording of the augmented limb leads. What are now, next question is, what are the waves which you see in an ECG? So now you will find that there are certain records which are coming above the baseline and they are coming below the baseline. Those records which are above the baseline are known as the positive waves, and those which are coming below are known as the negative waves. So basically, if you see the wave, there is one P wave, Q wave, R wave, S wave, and a T wave. P, Q, R, S, and T wave. One more wave rarely is present, it is also called as a U wave. But just for academic purpose, remember that there is a U wave, but most of the times we have got these 5 waves only: P, Q, R, S, and T. See among these, which are the positive waves? The deflection which is above the baseline is a positive wave. The deflection below the baseline is a negative wave. So P wave is a positive wave, R wave is a positive wave, T wave is a positive wave. Those below the baselines are the Q wave and the S wave, and they are the negative waves. So P, Q, R, S, T are the waves recorded in ECG. In that record, the P wave, the positive waves are the P wave, R wave, and the T wave. The negative waves are the Q waves and the S waves. Now there are certain divisions which are known as the intervals. So in a ECG, if you remember just earlier I had said, we can record the time duration. So there are certain intervals which are known, the PR interval. The PR interval is the interval between the beginning of the P wave and the beginning of the Q wave, and this is known as PR interval. Then there is another interval or time period between the beginning of the Q wave and the end of the T wave. It is known as QT interval. So I am just introducing the terminology here. So we remember that there is an interval which is called as a PR interval and a QT interval. PR interval is the time period taken by the wave to travel from the beginning of the P wave to the beginning of R wave. It is called as PR interval. It is 0.16 seconds. The next wave is the next interval is the QT interval, which is the wave which is recorded between the onset of Q wave to the end, not the beginning. See here, it is the end of the T wave. It is known as a QT interval and it is 0.35 seconds. I'll come back to this QT interval just a little later. We'll finish off the other waves here, other ones. In addition, then the interval between the two waves is known as R waves is known as the RR interval. So this RR interval helps in calculating the heart rate. Then there is a segment which is also known as the segment between the beginning of the S wave and the beginning of T wave, and that is known as the ST segment. It is known as the ST segment. Briefly, before we end here, I would like to highlight this on the QT interval. I'll repeat it, of course, in my next class on the ECG on Wednesday. The importance of QT intervals in the present context of the pandemic. Now, just to add to your clinical knowledge here, you would have heard about the QT intervals being recorded regularly on some patients. So now I'll just tell you briefly, in this COVID-19 patients, one of the drug which is being given is known as the hydroxychloroquine. When you give a hydroxychloroquine drug, it is made mandatory and specifically mandatory for all adults and hypertensive patients to know the QT interval. The contraindication is if the QT interval is more than 500 milliseconds, the drug hydroxychloroquine should not be used. It should be given only to patients whose ECG shows a QT interval of normal or less than 500 milliseconds. Above 500 milliseconds, if this QT interval is prolonged, it should not be given. So that is the importance of the ECG and the QT interval, because it is known that hydroxychloroquine intervenes with this conduction. So what does this QT interval signifies? QT interval signifies the time taken for the wave to travel from Q wave to the Q to the T. If this is prolonged, that means there is some conduction delay happening, and this drug, if already the conduction velocity is somewhere around more than 500 milliseconds, you give this drug, the conduction velocity will be more delayed, so conduction delay can happen with hydroxychloroquine. Hence, for those patients who are suffering with this COVID-19, hydroxychloroquine is not to be given or is contraindicated in those patients whose QT interval is above 500 milliseconds. We will stop here today for the day. Come back on Wednesday and I will discuss about the importance of the various waves which is present, what is the cause of those waves, and what is the significance if their intervals are increased and if their voltages are altered. Thank you all of you. Have a nice day.